Bro, you explained normal breath sounds. What about abnormal ones? How are they heard with the stethoscope?
Okay, today I'll tell you about abnormal breath sounds. First you listen this. This is crackles, interrupted non-musical sounds. If it is less loud and arising from alveoli, it is fine crackles. If it is high-pitched and arising from bronchi and bronchioles, it is known as Puss crackles. This is rhonchi, continuous musical added sounds. Low pitch coming from large airways is sonorous type, and high pitch coming from small airways is sibilant type. This is wheeze. High pitched musical sound mainly occurs during expiration. Strider. Harsh loud breathing mainly seen with inspiration. Save this for later and follow for more.